So introductory speech, the title is The Principles of the Skin Flap Operations. The flap operation is a technique to transfer from a donor site to a recipient site with an intact blood supply, unlike the graft. The flap is originated, the words of a flap originated from the Dutch word flappe, and the history of a flap is started about 2,700 years ago from Indian literature. So we have several principles of flaps, like the principle 1, replace like with like. To camouflage reconstruction, use a similar donor tissues as possible. If not, use the next most similar tissue substitute. Like in case of the eyelid defect, we can replace the lower eyelid defect with the upper eyelid. Under the title, the combining more than 2 flaps for reconstruction of a single defect to achieve the final best aesthetic outcome. Please, Jess, can you turn on your microphone? Okay.
Yeah. Yeah. Can you hear me?
Yeah.
Yeah. Okay. Thank you for Professor Hall. And sorry that I cannot show my face because the camera is not on. And today my topic is to combine more than 2 flaps to reconstruct a single defect. Okay. Okay. Just like Professor Hall said that this is a cosmetic unit, and we should hide the scars in the cosmetic unit junctions and do not bridge across the unit. I think when the defect involves more than 1 cosmetic unit, I think if we have time and the patients are willing to cooperate with us, I think it's better to reconstruct separately.
Dr. Won, could you turn on your microphone? Microphone.
Do you hear me?
Okay, good.
Okay, sorry, yeah. Okay, good evening. I'm happy to share my clinical experiences with repair of lip and perioral defect after skin tumor surgery. First of all, thank Dr. HUH for organizing this meeting. Thank you. My presentation consists of these. I briefly talk about the anatomy and some considerations in the reconstruction of this area. Then I present my cases. Let me start with the anatomy. Lips and perioral region are the central feature of the appearance. Therefore, the symmetry is important. The lips are composed of upper and lower lips with both a vermilion and a cutaneous component. This area has rich vasculature and rich central innervation. It is bounded by nasolabial folds laterally, mental crease inferiorly.
Yes, thank you very much, Professor Ha. Can you see my screen?
Yes.
Okay.
Okay, good.
So my name is Krisinda DIM-JAMORA. I specialize in most micrographic surgery and procedural dermatology. And I'm a hospital-based dermatologist working at 2 teaching hospitals in the Philippines. That's the Medical City Ortigas and Mackey Medical Center. So I want to emphasize that we share common values in the Asian culture, which include family traditions, socialization, and really in our culture, the elderly, our parents and grandparents, are usually a part of our daily lives. So it's not unusual.
So I think the Chrissy, you have the little bit big operations, like you using the general anesthesia for the surgery. Do you usually do the general anesthesia or the like some kind of the local anesthesia?
Okay, so usually if the 95% of the time I use local anesthesia. So I talk to the patient if they can manage under local anesthesia, it's still better because usually the Mohs surgery takes so long to clear. But if they're nervous, and as you can see, those big defects from the nose and the perioral area, those will need either intravenous sedation or general anesthesia. So it would depend on the final surgical defect. And also, if the patient is very nervous,